The CDC and FDA are authorizing the use of updated COVID-19 booster shots for children. Garrett Tenney has more.
The FDA and CDC are signing off on the use of updated COVID-19 boosters for kids as young as 5 years old. It comes as the U.S. works to expand protection against the coronavirus ahead of the holidays in the wake of new vaccine-resistant strains.
We are tracking variants as they arise around the world, and we have seen several now that evade several of our treatments that are very immune evasive.
Last month, Pfizer and Moderna rolled out updated bivalent doses of their vaccines for adults. They contain half the recipe for the original coronavirus, while the other half fights the new dominant BA4 and BA5 Omicron strain.
I'm going to get my 10-year-old the new updated COVID vaccine, and I'm going to encourage every parent I know to do the same.
These new kid-targeted versions contain smaller doses of that mix, but they haven't gone through clinical trials. The FDA says it's relied on data gathered from the original bivalent boosters to make its recommendation. Researchers say this isn't unusual and is done with the flu vaccine as well.
We have been doing this for years upon years with influenza vaccine. I am trusting and my own teenagers are getting this vaccine because we have such great data from a safety and efficacy standpoint.
Approval for the kid doses come as health officials warn of a rise in respiratory illnesses among children, and after a new Scottish study found 1 in 20 people have not recovered from COVID even after 6 and 18 months of being infected. As winter approaches, federal health officials are urging a pandemic-weary public to stay protected and get boosted, ideally by Halloween. In Chicago, I'm Garrett Tenney, Fox News.